Dr. Forum 50. We've been discussing the topic of emergency medical services in Sonoma County, and right now I'd like to open it up to all three of our guests and raise some questions that have been brought up by you, the public. And the first one that comes to mind is, why are ambulance costs perceived as being so high in Sonoma County? I'll leave it open to anyone who wants to start with that.
Well, I think that the reason that they're perceived as being high is that they are. They're very high. They're the highest rates in at least all of Northern California, if not higher. The reason that they are high is because we have too many ambulances to meet the needs of the public. And because the cost of an ambulance is basically the same whether it's going on calls or whether it's sitting there, the more ambulances we have sitting around not going on calls, then the higher the cost per unit of service.
It seems like the more ambulances we have, the more competition there is. Why doesn't competition bring down prices?
Well, you have to differentiate between economic competition, which is the law of the marketplace, supply, demand, and price balancing each other out, and the street-level competition or ambulance war-style competition that we've seen at times in this community. One of the reasons that economic competition doesn't apply in healthcare was what you brought up earlier. People don't shop around for an ambulance. They don't say, well, Joneses are having a sale on heart attacks, so I'll call the ambulance this week rather than waiting until next week. And they do get the closest ambulance, so there is no shopping around competition.
It's also not like a new product. We just don't go out and have a heart attack because it's the in thing to have. We don't go out like we go out and buy a coffee maker. Okay, there's only so many people and so many illnesses needing ambulances. So there's a controlling factor on the market.
I think in all fairness, one of the things we need to identify is the fact that the majority of the areas of this county are properly serviced by the right amount of ambulances, that the main source or the main problem that occurs is actually here in the community of Santa Rosa itself, where there are two competing firms essentially servicing the same area, although traditionally have serviced certain sections of the community as opposed to servicing the whole community at a time. And that has become the focal point of this entire issue. Because this is the area of competition, this is the area of the highest call volume, and therefore the most, open to public view. Chief O'Shea's situation in Guerneville and Petaluma and a lot of the other areas, there is no competition. They have scaled down their service to provide the optimum type of service with the right number of ambulances and personnel.
But still, even though our service is scaled down, as you say, and our rates are indeed somewhat or quite a bit lower than other rates, our rates are high because people came to expect or demanded a level of service that costs money to maintain in place, and in reality we might not have enough actual ambulance patient transports in a year, so the cost goes up. Even though our costs are frozen by state law, Proposition 4 and other voter-approved mandates that freeze our cost at we can only charge what it costs us to provide the service. We are not a profit-making organization. So there's a little bit of a hammer there and a little bit of a wedge on us at that level.
We have a similar situation, at least with our service, in that we can offset the cost of operating our service and therefore our vehicles, our personnel, through using our ambulances for other uses than emergency calls. Mm-hmm. And in Santa Rosa, it's entirely possible to do that. But in communities like Leonard Park, Cotati area, even so much as Sebastopol, there is not that type of volume to offset that cost. And yet there is no mandate to drop the level of service out there because there's an insufficient number of runs to pay for the service, per se.
In one respect, people have come to expect a level of service because of wonderful TV programs like Emergency, that they saw fire departments responding and paramedic ambulances, and we all should have that, and I won't disagree that we should have that. But in reality, is it economically feasible, and what is the response time that we can do some good in the response area that we're working in, and is a paramedic really necessary?
I think the Board of Supervisors has reflected that somewhat in their ambulance subsidy policy, that we subsidize only the rural services where we want to maintain that minimum level of service, even though the call volume may not justify it. We want to provide that service. We're no longer subsidizing the urban areas that should be able to support that through the user fees.
In our operation, we share our employees between fire suppression, fire prevention, equipment and building maintenance, and ambulance operations. There are days when we use volunteer firefighters on the ambulance because both of our ambulances are busy in Guerneville, and there are days that we use the ambulance people to operate the fire department doing the dispatching while we're running busy on fire calls. It's a kind of a rob Peter to pay Paul situation, and to do the most with the minimum amount of manpower. We are not totally a single-purpose agency, and Ken alluded to that earlier, that they can do that they try to make those methods work in the private sector by doing non-emergency transports and rental and other kinds of operations, and I think they're really trying to do that very well.
Okay. Another question that's come up is if you respond to a patient, respond to an emergency, and end up not transporting that patient, does the patient get charged for the services?
From the private sector point of view, previously they were not being charged for these services because these costs of responding and not transporting a patient were being subsidized by the county. In the past several years, the county has all but terminated that type of subsidy for non-transporting runs, or dry runs as we call them in the business. And to us, that meant a significant reduction in available revenues and cash flow to operate our business. And our options at that point were, one, to raise our rates, which we are not willing to do at this point, or to begin actually charging the people who are using the service. And we are charging a minimal fee at this time for non-transporting runs where a patient receives some service from the ambulance crew.
Okay, good. We'll be right back after this message, and we'll talk about what is in the future for EMS in Sonoma County. Stay with Dr. Forum 50. I'd like to take just a minute here and ask Kevin O'Shea if he can let us know, do the public ambulances charge for dry runs?
At this time?
Sometimes you like to define a dry run, an ambulance that responds to an emergency but does not transport a patient.
This time we do not charge for dry runs, and it's been a help to us. We use our ambulance to run medical aids inside the fire district. It has reduced the actual alarms that the fire department has responded to, and we felt that that was a safe trade-off, and we do not charge for dry runs.
Rick, did you want to say something about that?
Not concerning the dry runs, just that the subsidy was not necessarily cut out from dry runs, but it was shifted into what we thought was a needs-based subsidy for the rural areas.
Okay. What I'd like to do now is put up on the screen the number for the Emergency Medical Services Dispatch. You can call that number should you need any type of medical emergency in Sonoma County. And also I'd like to put up a number if you have any further information or request any other further information regarding emergency medical services in Sonoma County. You can call that number. Are we getting a 911 system in Sonoma County? That's another question that has come up quite a bit. Maybe you could shed some light onto that.
Yes, we are. By state law, all counties in California are supposed to have a 911 system. We are scheduled to go online later this year with a 911 system in conjunction with Marin County, and hopefully the time frame is right, and it will be online in November.
Okay, well, that's about it for today's show. I'd like to thank all three of you for being on the show today. I'd like to thank the audience for watching in. If you have any other questions, like I said, I had the number up on the screen, and you can look the number up in the phone book for the Emergency Medical Services Office. Thanks again for being with us. We'll see you next time.